Sexual health is a critical part of overall well-being. Whether someone is dating occasionally, in a committed relationship, or working within the adult services industry, practicing safe sex protects both personal health and public health. Recent reports from the UK show important trends. According to the UK Health Security Agency, syphilis cases reached 13,030 in the year 2024. That figure is 5% higher than the year before. It is the highest level recorded since national records began in 1948. Gonorrhea cases in England were reported as 71,802 in 2024. Although this is a 16% reduction compared with 2023, it remains the second highest level recorded in decades. Specialists have raised concerns about treatment options because 14 cases of extensively drug-resistant gonorrhea were confirmed in early 2025. These statistics are also published by the UK Health Security Agency. Chlamydia continues to be the most common sexually transmitted infection in England. It accounts for almost half of all new diagnoses, with people aged 15 to 24 being the most affected group. This is based on the annual data tables published by the UK Health Security Agency. At the same time, demand on clinics has grown sharply. In 2023, sexual health services in England delivered 4.6 million consultations. That is a 44% increase compared with 2020. However, funding for local authorities' sexual health services has been reduced by approximately £230 million since 2013. These figures are from a briefing by the King's Fund on sexual health funding. These numbers show that infections are not only common but increasingly complex to manage. Prevention and early action are essential. Safe sex practices are not limited to traditional dating. In the escorting industry, many professionals follow strict health routines. For example, they arrange regular testing, often monthly or quarterly, to maintain a clear record of their health status. They use condoms and other barrier methods every time without exception. They set clear boundaries and agree on services before any meeting. They also operate with confidentiality, and many platforms now use identity verification to protect privacy. These measures are reported in guidance from SWOP behind bars and research by the Beyond the Gaze project. These standards show that safeguarding health is not only about using condoms. It is about creating a culture of responsibility and informed choices. Here are 5 practical steps supported by UK health authorities. Step 1. Always use barrier protection. Condoms and dental dams reduce the risk of infections such as HIV, syphilis, gonorrhea, and chlamydia. Even for oral sex, barriers are recommended. This advice is published on the NHS sexual health pages. Step 2. Get tested on a regular basis. Many infections show no symptoms for a long time. Testing is the only way to confirm your status and begin treatment early if needed. Free and confidential testing is available through NHS clinics, and home test kits are widely offered. Step 3. Communicate openly. Discuss your testing history, contraception use, and personal boundaries with partners before engaging in any sexual activity. Within the escorting industry, this type of conversation is standard practice. Guidance from the UK network of sex work projects emphasizes how clear agreements help build trust. Step 4. Stay informed about local infection trends. Public health agencies, such as the UK Health Security Agency, regularly publish updates about regional outbreaks and resistant strains. Staying informed helps you make safer choices. Step 5. Consider vaccination when it is available to you. The human papillomavirus vaccine, known as the HPV vaccine, protects against certain cancers and genital warts. The NHS offers this vaccine to eligible age groups, with private options available for others. These practices are not just theoretical. They are in place every day within professional settings and can be applied in personal relationships as well. Routine screening, clear consent agreements, and discretion provide a strong example for safer connections. Adopting these measures is not about limiting intimacy. It is about protecting your health, respecting your partners, and reducing the wider public health burden. For reliable information and free services in the UK, you can contact NHS Sexual Health Services. You can also access advice and clinics through Brooke Guidance and support through the Terence Higgins Trust, and information on contraception from FPA UK. Finally, mental health is equally important. If you are a sex worker or an independent escort and you need support, there are organizations ready to help you. National Ugly Mugs provides safety alerts and confidential assistance. SWOP Behind Bars offers health guidance and peer support. Maggie's Leads provides outreach and counseling tailored to people in the industry. You are not alone. Your well-being matters, and support is available. The information provided in this content is for general education and awareness only. It is not a substitute for medical advice, diagnosis, or treatment. Always seek guidance from qualified healthcare professionals or trusted organizations if you have questions about your sexual health, mental health, or well-being. References to support services such as National Ugly Mugs, the National Health Service, Samaritans, and Mind.org are offered as examples of available resources in the UK. Your personal circumstances may vary, so please use discretion and consult professionals where needed.